the profound anesthesia protocol that enhances your endodontic procedure. Nothing destroys patient trust faster than pain during endodontics. And nothing destroys your confidence faster than a patient who won't go numb. We've all been there. You've given 2 carpules of lidocaine, waited 15 minutes, and the patient still jumps when you hit the dentin. You begin to sweat, and they're crying. Everybody's miserable. And the problem, you're using the same anesthesia technique for every case. Hot teeth, especially those lower molars, require a different playbook. Here's what I teach in Success in Endodontics 3.0, my protocol for profound anesthesia, even in the worst hot teeth scenarios. First, set expectations before you start. Tell your patient, this tooth is highly inflamed, which makes numbing more challenging. I'm going to use multiple techniques to make sure you're completely comfortable. If you feel anything, raise your hand immediately. We'll stop and add more anesthesia. My goal is you being completely comfortable. It's a black and white issue. This one conversation eliminates 80% of their anxiety. Now, the 4-injection protocol for mandibular molars. First, I will use an inferior alveolar Gauge block, either with lidocaine or articaine. Of course, I've already used a topical on the mucosa for about 2 or 3 minutes. Second, I will go away from the chair for a few minutes and come back and give a long buccal infiltration, followed by a lingual infiltration. Intrapulpal anesthesia as a backup if you're still getting sensitive after accessing the pulpal chamber. Place a 27-gauge needle directly into the pulp chamber. Inject under pressure until you see blanching. And when patients tell their friends, I had a root canal and didn't feel a thing, that's worth more than any Yelp ad you could ever buy. Your reputation as the dentist who does painless root canals becomes your biggest marketing asset. We demonstrate injection techniques with chairside video in Success in Endodontics 3.0. And I have a question for you. What's your go-to technique for hot teeth? Please drop your tricks in the comments below.